Look, will you be absolutely genuine with me? No deception, please. I want you to do something that expresses you without the slightest deception.
So welcome back, episode 9, Genuity podcast. Very special guest today, Dr. Joaquin Rosado from Biocure Health, who was a major component after my accident in my journey getting to be able to walk again. He's a chiropractor, PT, background specialist with stem cells and peptides and TRT and just a whole part of this future movement of health. He's been a dear friend of mine now for years. And welcome, Dr. Rosado. And
thank you.
Thank you for coming. I wanted to really start with talk a little bit about you as a person before we dive into the whole doctor part, because I think that's a really big part of someone's journey. You know, when they get hurt, especially what I went through with, my son losing his appendix, or if anyone's ever been in the hospital, at the end of the day, no one really gives a fuck. That's what I experienced. And you're just a number and you're getting pushed through the system. They just want you out. I have a whole theory where hospitals are basically like hotels where they're just, their beds need to be full for them to make the money. And I was kind of hopeless at the time that I was in, really down and out. I was sitting in a hospital bed at that time for about going on like the 80th day. And I had some really successful PTs and therapists on the island. And we started hitting these roadblocks. And just a small world of some old friends that were down in Miami said, hey, listen, I have this guy, Dr. Rosado. He's miles ahead of anyone else that's out there right now. And I really think you should help him. He can help you. And I'm going to, put you guys in contact with each other. I gave your office a call. I remember that you said, I'll call you back in a couple hours on my drive home. And you basically held my hand on the phone for 45 minutes like I was talking to my fucking dad. And I never felt so. You explained to me, I had a little bit background at that time of peptides and stem cells, and you really just like put me at total ease. It was very affordable. He hooked me up with the whole that credit card of like 0% that you get approved, no problem.
Sure.
But he could care less about the money. He was like, listen, just get down here. Let's get you started. It's going to be a multiple stage process over the next couple of years. And explained to me exactly how he would do it and made sure I was totally comfortable, and sent me emails and phone calls. And you were the doctor directly. I thought maybe you would have been like a manager at that point. And then I show up to your beautiful office in Weston, Florida. It's all just nothing but professionals. And I really, wanted to thank you and really dive into start off with really like a little bit of your background and what made you choose this almost holistic, unbeaten path of medicine that you chose to go down.
Yeah. So I guess first of all, I just want to thank you for allowing me to be a part of your healing journey, because that's why we do what we do, right? As doctors, and that's why actually we should do what we do. Myself and my team, I think we try to go the extra mile to make people feel comfortable. That's the part one of healing, right? So I guess thank you all for having me on. My name is Dr. Joaquin Rosado. I'm practicing for about 12, 13 years now. We've had the clinic open in South Florida going on 11 years, which is just mind-blowing how fast it's been. But, my background is, I went to school for cell biology. So, very familiar with cellular biology, just fascinated with the way the body works. So I ended up going to chiropractic school. So I graduated with a doctor of chiropractic. Once I graduated, I became, licensed and in the state of Florida. Also, we started getting licensed in various states. But I went, I practiced for a few years. We did PT, we did chiropractic, we had acupuncture, just looking at the body as a whole, right? Because you can't just separate. I think the problem comes in medicine where, everybody is just so specialized, and they kind of just, they zoom in too much as opposed to just taking a step back and seeing how the body works as a whole, right? So went back to school And I got my fellowship and I got board certified in functional medicine, anti-aging, and metabolic medicine. So that opened up doors for us to be able to offer more things to patients, which came with, the stem cells, the exosomes, testosterone replacement, testosterone restoration, a whole suite of peptides. And myself and my team, we've gone, the extra mile to really, really be on top of all the studies, any of the new things that are coming out, and really just kind of just knowing what's out there to best help, our patients reach optimal health.
I want to get into I really want to jump into the stem cells, if that's cool with you guys.
Yeah, absolutely.
So, quick background, because I'll talk everyone's ear off. So, basically what happened with me in a nutshell is when I got into the accident, I think a really good analogy the doctor used was my leg showed up to a fight and my knee got knocked the fuck out and the rest of my body just ran. So now I had this neural paralysis, which is basically when like the avatar lights shut off from my brain to my hip. I had a swollen, basically useless knee capsule, right? That's where we started, which is what filters the inflammation and also brings the blood back up from your foot back towards your heart, where your guys is like a piano strings. Mine was like wet ramen noodles. I had drop foot. I had no calf whatsoever. And I had a sciatic nerve, which I didn't even know at the time that wasn't even working. So I'm trying to build all these muscles and there's just nothing there. So on a straight leg, right, that's 0 degrees, and a maximum flex is like what, 140, 145 on a fully bent knee. My range of motion when I left the hospital bed was 3 to 20. All right, you can't drive till you get to 90. So I get a call from Doc. I feel super confident. I think it was like the second week out of the bed. I got wheelchaired off of the airplane, and I got wheelchaired into the office, right? And he basically, he has professional orthopedics there, and he had this whole diagnosis of these stem cells, and I walked out of the office in 2 days, and I never went back into a wheelchair, just off the rip, and I continued to go 5 or 6 treatments over the course of like 2 years, and every single time, and we're gonna have my other doctors on here that will support this, and they don't know what he did, but right, Rob was like mind blown. Yeah. Every time I would hit a 6 for 6. If I was stuck at 20, I went to Florida, I came back, I hit 40. I got stuck at 42, I went to Florida, I came back, I hit 60. I got stuck at 61, I went to Florida, and now I'm at 0, which brings your full VMO growth, which is your quad, that teardrop. You can only get that from a 0 degree extension when you walk. So with only being at 2 degrees, that 2 degrees doesn't sound like a big deal, but I had full, basically death of the muscle. Yeah. It's like an amputated leg with a real leg. And I wanted you, maybe if you can get into a little bit with me as an example of like, how did you go about, so I just come in, I'm 60 pounds less, I'm a fucking train wreck, like I have, a plate in my collarbone, I'm in a wheelchair. How do you look at me and diagnose, what kind of stem cells are we talking, why use those, and how did you even go about that going into my case?
So one of the biggest things that we saw in your case in specific was atrophy from the waist down on that one leg. If you don't get blood flow there and you don't get nerve conduction there, your tissue is just gonna start to waste away, and that's atrophy, right? So the quad muscle had completely just disappeared. There was swelling in the knee, behind the knee, and it was also a lack of movement, but also there was just so much edema or inflammation in that particular joint that was just compressing everything that would allow for that fluid to move back up to the torso. Right? Remember, there's the heart from the chest cavity that pumps blood out, but the only way to get blood and fluid and lymph back up is by contracting and moving those muscles. Right. So if you have no muscle contraction, if you have no range of motion in those particular joints, things are just going to pool there, and it was just moving in the wrong direction, right? A whirlwind moving in the wrong direction. So we just had to basically start eliminating inflammation or edema, right? And restoring nerve conduction. So one of the beautiful things about the nervous system is that nerves can actually regenerate, right? The body as a whole, we have a regenerative capability, right? But the nervous tissue has an unbelievable amount of ability or capability to regenerate. So the idea was any of that nerve damage that you sustained within that accident, we would have to try to reactivate, regrow those nerves, right? So from step one, the first day you got there, we were working on from the hip, from the sciatic nerve that goes down into the leg, because the sciatic nerve comes off the spine, goes under the butt muscles, and then behind the knee splits into two, right? So the idea there is we had to track what was the area that was damaged. And then with micro injections of stem cells and PRP, we were able to reactivate and regenerate a lot of that lost nervous tissue that you had there. So we were able to repair some of that nerve damage. I think that's essential in making sure that you can actually start to reactivate and regrow these muscles, right? And then once you start getting movement, now you start eliminating that edema, right? That inflammation. So the types of cells that we use, there's lots of different types of cells that we have access to. But the ones that I've seen work best are mesenchymal stem cells from the umbilical cord, right? Some places they'll do liposuction, like a little mini liposuction, take cells from the fat tissue, and then those are the ones that get processed and injected back into the body. To me, just knowing the human anatomy and how it works, our body stores toxins in our fat, right?
Oh,
so if you're isolating fat and injecting that into the body, you can technically be injecting extra toxicity in a concentrated dose right into that tissue. To me, that's not even an option.
Wow.
Second one would be utilizing bone marrow, right? So now what they'll do is they'll go into either the iliac crest, which is the hip, or the femur, which is your quad bone, right? They'll drill a little hole, pull out some bone marrow, that gets processed, they isolate some stem cells, that gets injected back into the patient. Now, that works good. Those cells are great. However, cells are migratory. Stem cells are migratory, right? So if we're trying to heal a part of your leg, why would we want to create a more acute injury by drilling a hole into your femur, right? So now all of a sudden, let's say we inject, and I'm just making up these numbers, 1 million cells into your knee. Part of those 1 million cells are going to go up to the hip bone where we just drilled a hole to heal that tissue. So now your healing capability just got cut in half or less, right? So utilizing something like mesenchymal stem cells from the Wharton's jelly of the umbilical cord, that you're not having or you're not adding an additional injury to the patient. You have very vibrant 9-month-old stem cells, right? Where now all of a sudden, when you couple that with the PRP from the patient, that's going to actually help reactivate it, right there, activate those cells, turn them into your cells, then that gets injected into the area that we're trying to heal. Much more vibrant, much better efficacy or effectiveness of that particular treatment.
So I have a question about the actual stem cells because I remember listening to, I think it was actually a Rogan podcast years ago, and I know that different doctors' offices in different countries actually use different kinds of stem cells, I guess from what's allowed in the United States and in other places. So I know in, let's say, Panama, and I could be wrong on this, so please don't quote me, but I think rather than using, what'd you call it, the Wharton's jelly, I think they actually use fetal stem cells, and I could be wrong, and those are considered golden stem cells, and I know that other places in our own country use cadaver stem cells, which I heard can actually deteriorate over time. And again, I could be wrong. These are just things that I've heard and that I've looked up. So I know there's going to be a lot of listeners that are listening to this that know what you're speaking about from the Wharton's jelly, the golden stem cells from fetal, and the cadaver. Can you kind of explain why in some cases certain areas would use a cadaver knowing that it actually might deteriorate over time and that somebody would have to constantly come back and keep getting these treatments, and why people just aren't using what you're using, which would be the Wharton's jelly, which I guess has the longer and the more prominent solution fix to whatever's going on?
I think a lot of it comes down to, especially in the United States, an ethical question, right? So using, and they used to before, they don't use it anymore, I don't think, at least not in this country, fetal stem cells. Now you're looking at essentially like aborted babies, right? So then you're taking those stem cells from the aborted babies. That's an ethical question. No matter where you fall, I guess, in the States, you can't use it.
Right.
the biggest difference, I think, between what happens stem cell wise within the United States and what happens in other countries is that in the United States, you use first line stem cells, meaning those stem cells come directly from the umbilical cord or the placenta, wherever it is you're getting it from, and that is being utilized direct from the patient, from the actual, the mom or the baby, straight to the patient. No manipulation, right? What they do in other countries, or what they can do in other countries, they'll take those first line stem cells, they'll put them in an incubator, and they start to replicate them, right? So now when you start hearing overseas, oh, they're putting in, 500 million stem cells,
I wanted to bring this
right,
up.
into a patient, what you're doing is you're getting copies of original stem cells.
That was going to be my next question, so I'm glad that you brought that up.
Yeah, I wanted to
continue.
touch that also.
Yeah, so think about it like if you get a piece of paper, right, first line piece of paper, and it's got, notes on it, and you take a photocopy of that paper, right? Then you take a photocopy of that photocopy. Right. Then you take a photocopy of that photocopy. 10 generations down, you'll have a blank sheet of paper.
Right.
Right? So what is happening to the potency of those particular stem cells is they're actually going down. Yeah, you could be getting a lot of them, but you could be going down. Another issue there, which I think could also be arising, is when you replicate cells, that's where you can have cells that are not optimal, right? There can actually be retarded cells. Yes. They're not functioning optimally, right? So now you're flooding the body with good cells, but also who knows what cells. And those end up becoming zombie cells, which we know can create inflammation in the body, can aggregate and become problems down the road. Can be, right? Here in the States, using the first line cells, those are literally blank cells that will actually differentiate into that particular patient that we're injecting when you combine it with the PRP and inject it into the body.
Is there a way, I know the answer, but I want to make sure everyone watching checks this one out because he's the fucking man. Is there a way to make sure that when we get the stem cells that it's not from someone who had the COVID vaccine?
Absolutely. So that's a great question. So there's different laboratories throughout the country.
Important.
And then these laboratories will send us a sheet, and they actually handwrite and they sign the actual testing that they do on these particular cells for everything. There's a very few laboratories that rule out anybody to donate stem cells that has had the COVID vaccine.
God bless those places.
Yeah.
My question to you is then, can you detect any abnormalities in those stem cells? Is there anything that differentiates those cells, comparatively speaking, to somebody who is, let's say, unvaccinated? Is there anything that you can tell while scanning these stem cells that, okay, here's an anomaly, here's an abnormality compared to somebody who's unvaccinated?
In a laboratory, from what I have understood, because I have spoke to a lot of these scientists that work in these particular laboratories, the inflammatory markers are significantly higher for patients that have had the vaccine as opposed to the ones that have not.
And I really want to stress too, I'm glad you hit about the numbers because everyone's pricing and in ratio to the amount of cells is a big time. But I've gone, in 3 years, I've gotten hundreds of millions of cells combined. But we've never done, I think the most we did in my shoulder was 30 million, right? And it's definitely cheap compared to wherever else, but it's got a nice little penny. And I was at the OG event, and they had the one vendor there that was like promoting the stem cells. And it was one of like the vendors. And I go up there, say, "Oh, we do 100 million stem cells for $2,000." And I'm like, that's physically impossible. She's like, "Well, I have a degree." I said, "I don't give a fuck what you have your degree in. Like, my guy is the guy, and I pay 3 times that for 1/3 of that, And like, where are you getting it from? Well, they're stem cells. Are they placenta, umbilical? Like, are they femur? She's like, "No, they're stem cells." I'm like, and this is someone on Long Island that has a practice that advertises as stem cells. So I think the fact that you brought up the cloned and the copy, and a really good analogy of the paper being photocopied, is super important on quality over quantity, because you get what you pay for. And again, going back to myself, I tuned my shoulder up pretty bad. Another great story. Then we'll go back to Doc again. But I have some supraspinatus, right? It was the top muscle that wraps around rotator cuff, and I still go to a very holistic orthopedic up here. I went on a Friday. We've been lifting at the gym at the point. I was still shoulder pressing 225, and I was going for a cortisone shot. The cortisone shot's loaded. He's about to inject it with the ultrasound, and my supraspinatus is gone. It was 80% torn, non-retracted, which means it was like this off my collarbone. Now, if it was like this, doc's like, there's nothing to do. 70 MRI, he's like, we can do it. Went down there, we did 30 million shots. I kept it light. We did super light work for 60 days. I had no scar tissue. The MRI still says it's the same, but I mean, you saw me, but I couldn't even grab a 2-pound weight at one point moving forward. We're back to incline pressing 315, shoulder pressing 225. I have no more numbing in my fingers. I don't have that constant shoulder pain when I'm sleeping at night. And it's just the technology on that is just absolutely mind-blowing and fascinating.
I think what happens a lot of times is doctors get stuck on what they learned in school.
Right.
And for a lot of doctors, that was 20 years ago, right? So back then, the technology in stem cells, knowing what they do and how to utilize them right now, wasn't taught, right? So what'll happen is they just don't get it that utilizing these stem cells upon differentiation within the body can actually help to create new tissue, right? Because it's not just the stem cells that we're looking for, right? Stem cells are a component of that particular injection. What you're looking for is the stem cells. Within the stem cell, like on the outer layer of the stem cells, there's little vesicles that are called exosomes. Those are extremely regenerative and extremely anti-inflammatory, right? So you want the stem cells, you want the exosomes, you want within every specimen of Wharton's jelly, there's like 26, 27 different types of collagen within that injection. Our body's made up of collagen. Without collagen, we're a puddle of water, right, on the floor. So it's got different types of collagen and it's got different growth factors. Those are all components to healing, repair, and regeneration. So it's not just, and I think people, especially, their clinics that don't really understand it, is like they just get fixated on the number of cells.
Yeah.
And you nailed it.
100%.
It's not about quantity. It's about the quality of what you're getting injected into your body.
Right. You have any questions on
Yeah,
this?
Doc, would you also talk about the difference maybe between like an intravenous stem cell versus like injecting direct into the area? And I know obviously Mike had injury, but would intravenous stem cells be something that somebody would do just for like general health benefits, or what would you see the difference as, and what would you use in certain scenarios, one versus the other?
Good question.
Sure. So when there's an actual direct injury or problem, right? What you want is you want to be able to inject as many into that particular area that's injured and damaged. And with the PRP, it almost acts as a homing device for all the body's attention to just be right there. So in Mike's case, with the supraspinatus, we wanted everything, all of it, to go right there. So you go very heavy dose stem cell, the specimen, the regenerative specimen, plus PRP right into that area, and that'll help heal the tissue very quickly. You would go intravenous. You could also do intravenous just for general wellness, right? It's not going to necessarily fix a particular problem. What it does is it reduces inflammation. And again, it gets filtered by our filtering organs, such as liver, kidneys,
Liver enzymes
lungs,
drop significantly.
brain, and that can just help, repair tissue systemically. We're not treating anything. It's just a particular in the body, just to help the body's inflammation go down, just to help with making sure that, we can regenerate and repair, some damaged tissue throughout the body. Nothing in specific, it just goes systemic. So that would be kind of the main difference. A lot of times we'll want to do both.
When you get the stem cells, obviously you're getting it from a separate donor, but can you explain the PRP a little bit? Because I'm assuming you would get that from the patient themselves rather than the donor.
Yeah, correct. So PRP stands for platelet-rich plasma. So what we're doing is we're really trying to isolate platelets. So what we'll do is we take a blood or two of blood, tube or two of blood from that particular patient, the one that we're injecting. We spin it in a centrifuge. So then the actual tube, you'll see it kind of split. When you first put it in the centrifuge, it's a tube of red blood. When you pull it out now, you have an isolation of red blood cells on the bottom. And then on the top of the tube, you have plasma. Plasma is made up of white blood cells, platelets, growth factors, tons of cells in our body. It's basically our body's regeneration liquid in the blood, right? So then what we'll do is within that particular plasma, there's a layer that's called platelet-rich plasma, and a layer is called platelet-poor plasma. For large joints, like something that you're looking for volume, you would use the whole yellow liquid. For smaller issues like supraspinatus, or for instance, some tendons in the leg or knee, ligaments, you want to isolate only the platelet-rich plasma, because what platelets do is, if you think about, like if you cut yourself in your hand and you start to bleed, then all of a sudden you get like this gooey little clear little substance there that stops the bleeding. And that's actually what kickstarts the healing cascade, right? What actually stops the bleeding and turns into that little jelly liquid, those are platelets in your blood, right? So what we're doing is we're isolating about 10 times what your body would normally use for healing.
10 times.
Isolate that along with the stem cells, then that gets directly injected right into where the injury is.
What's with the PRFM? Is that with when you guys take the oxygen out of the?
So what we do with PRFM is we'll isolate the PRP exactly the way I explained it, right? But what we'll do is we'll take it and we'll put it in an incubator where it actually slowly heats up the plasma. When you slowly heat up the plasma, it starts to get thick. Now, since you don't have red blood cells, it will not turn into a scab into the syringe. It turns into that thick jelly substance that you find on the tissue. It turns it into that. And then you put it into a cooling component to the bioincubator, bring it down to body temperature. Then that's injected into large joints to create space. So a lot of times, like for instance, if you go to an orthopedist and you have degeneration in a joint, they might inject you with hyaluronic acid, right? All that is essentially a human fix-a-flat. It just creates volume within the joint. What we're doing though, as opposed to injecting something foreign, we're converting your PRP into what's called PRFM, which is platelet-rich fibrin matrix. That turns into a very thick substance. We create space, and then following that injection, we can inject the liquid PRP and stem cells. So if you have a collapse of a joint and we need to create space prior to regenerating that tissue, we might inject the PRFM first to create space, then we follow with the regenerative matrix.
And the longevity of that is significant compared to regular PRP, right? Because we did that on my knee 3 years ago and I've never gotten it redone. And I have no meniscus, no cartilage. I'm bone on bone.
Yep. So it gave us enough space to allow for the tissue to heal. If you're bone on bone and you're doing this every time you move, well, you're not going to heal any tissue. So if you create space, you're allowing for the space to be there to allow for regeneration to occur.
So my mom watches every single episode, and I love her dearly, but she's somebody who believes in the traditional doctor, and the doctors know everything, and she won't step outside whatever the doctor says because it's the end-all be-all cookie-cutter recipe from the doctors. I have been trying to get this woman to go on stem cells and to do PRP. So let's say I sent my mom to you, right? My mom has no kneecaps because her leg was severed off of her body and they had to reattach it by literally a tendon. 2 fake hips, fibromyalgia, osteoporosis, nerve damage, severe arthritis in her ankles, her wrists, her hips. The woman is the most damaged physically human being you could ever meet, but the best mother in the world. So if I were to bring her down to you, right? And I'm sure, because there's a lot of people from our gym also who suffer from, a lot of people that I've spoken to since this has aired, fibromyalgia, osteoporosis, arthritis, that there's no fix. They can't get better. They've done every type of cold laser therapy treatment or any type of acupuncture, and then it lasts a couple days and then it goes away. So if, let's say, my mom came down to you, what is a type of treatment that you would give to her? Because it's definitely not as severe as Mike's situation was, where he was, bedridden for 80 days. This is years and years and years and years later. So because her ailments have now built up over the last 40 years, is she even still a candidate, or would anyone in their 60s and 70s at this point still be a candidate to come down to you when there's so many years that have passed and there's so much built up tension in the body? Would your treatments still be something that would still benefit somebody like that the same way it would affect somebody like Mike, who was newly injured?
Yeah, it's a great question. So that's the question between chronic injuries versus acute injuries. So someone that comes in with an acute injury, it just happened, right? Something chronic has been around going on for years upon years upon years. It will absolutely, so when it comes to like chronic arthritis, let's say, so all that means is that you've lost the space within a joint. The joint is swollen. That's literally what arthritis means. There's a swelling in the joint, and it's being caused by the grinding from one bone to the other. That grinding causes a wasting away of that particular covering of that cartilage. So in situations like that, the idea would be to probably start with a PRFM to create space, right? Then from there, then we will inject the PRP and the stem cells. The way I explain it to patients is like this. As we age, our stem cell count or our stem cell bank drops significantly every year. If you compare a 2-year-old to an 85-year-old, there's a significant difference, not just in the number of cells, but in the cells that they do have, how vibrant they are, right? So what you're utilizing is almost basically tapping into the younger version of yourself to heal your tissue by utilizing the what's called the exogenous or external stem cells, as opposed to the ones that you already have in your body. We all have stem cells, but at 40 something, 50 something, 60 something, 80 something, your body's not going to be healing the same way that you were at 9 months. So we're utilizing or tapping into the ability or the increased ability to heal by utilizing external stem cells over relying on your own. Now, another thing that I always tell patients is this, and it's simple. With 2 hip replacements and all this going on, I would say that traditional medicine, there's been a little bit of a shortcoming there, and it might be worth giving something else a shot, an opportunity to potentially work.
So
it's not using traditional medicine or her current doctors. It's working in conjunction, right? To help her. The only person, doctors' egos should not be damaged at all if a patient decides to utilize various doctors.
Do you think
the person that works that matters in that calculation or that formula is the patient?
So I have my own theory on Big Pharma, which I don't need to tap into in this episode. But do you think that maybe, and you don't have to answer if you're not comfortable with this, but do you think that maybe there is a systematic ploy to keep people on medication, and that ultimately that medication could actually be doing more adverse effects to the body, like being on all these, I think it's called like a valerian gel or a vegetarian gel, whatever that is for arthritis, and all these different pills that my mother takes. Do you think that those could actually wind up making her maybe a little worse in the long run?
I think a lot of times, and I see this way too often, is a patient will start on one thing. They'll be on it for a little bit, and all of a sudden, maybe they're on that medication and that causes some kidney damage. So now they're on another medication to fix the kidney damage, right? Which eventually ends up causing cardiovascular issues. Now they're on another medication to start fixing the cardiovascular issues, which goes around and actually can cause a wasting away of collagen. So they're like in this vicious cycle where at some point, someone's got to take a step back and say, well, what the heck is going on, right? Take a step back and say, what is it that she really needs? What is it that could be potentially causing a lot of these issues? And how do we fix it outside of their traditional box?
I have a great idea.
Yeah.
I think there's a great thing out there called the methylation test that fixes exactly that, which would be a perfect transition right into that on the topic. So why don't you go down that route? So someone who is in that scenario and they're all over the place and this pill is helping this but hurting that, and then hurting this, and that medication is hurting that. How does this methylation DNA test that you provide that ships right to your home at a very cheap price, that is just an easy cheek swab that I've done myself, my wife has done it, my kids have done it, let's talk about that and how can that help someone that you provide in a situation like that.
That was like a perfect sponsored transition.
Yeah, it really
like,
was.
Brought to you by methylation test from Michael.
So, all right. So that gives us the thing about this test is the beauty of this test is literally you do it once in your lifetime, right? It's all it is just looking to see what genes in your DNA are turned on, what genes in your DNA are turned off. So it lets you know your predispositions in the future. It doesn't necessarily mean you have something now. It means that you're more predisposed to have something in the future. So there's various labs that do these tests. Some of them will be more specific on, type of athlete you are, how your body responds to exercise. Some might be nutrition-wise. What is your body more capable of processing genetically than not? So then all of a sudden you might be able to choose the correct diet for you as opposed to just whatever's trending on social media, right? And then there's looking at what's called the sirtuins or the caps of the actual DNA helix. And those, looking at particular lengths on that, can actually give you an idea how your body's aging. So now you have a better idea as to how you can manage the aging process, right? So it'll look at like your chronological age, like whatever your age actually is, versus biologically, how old is your body actually?
Oh, shit.
Right? And I think that is one of those things where a lot of people, they think they're doing things properly. And then once they do this test, they realize, wow, so I might be, 40, but I'm aging at a 50-year-old rate. Why is that? And then when you dig deeper into methylation test, now there you can say, oh, because whenever I eat X food, it causes excessive, inflammation, so on and so forth. So now it's costing my body time or aging, right? So that's a really amazing science and technology to be able to take a look or take a deep dive into that particular person and say, okay, how are they aging? Why are they aging either good or bad? And what is it you can do to actually start to reverse that?
Now, would this test wind up offering them a conclusive kind of indication of different types of supplementations, of methylated supplements they should take? And would this also be an alternative route where they can supplement with these and then wind up coming off some of the other medications that they're taking that are prescription-based?
Absolutely. Absolutely. So the idea here would be, okay, what is it that how is it your body processes certain things that you eat, supplements that you drink, how you're exercising, how you're sleeping, things like that. So now with that data, obviously information, as we all know, information is power. The more you know, the more you can actually make the decisions which are going to actually help you achieve the goals you're looking for. So it'll help with, and one thing that I've seen pretty amazing is once we do the genetic testing and we do the biological versus chronological methylation test, that biological versus chronological test you can do, let's say once a year, right? I think any more than that, it's overkill. The genetic testing you do once. So once you find out how your body genetically is best processing foods, supplements, exercise, now you retake the biological versus chronological age, and you may have added 1 year or one candle to your cake, but you might have actually erased 3 years from the actual aging process. You might have actually aged in reverse that year. So that knowing how to actually juggle the supplements, how to juggle, exercise, that is essential for making it, because at the end of the day, it's not about making it to 100. It's about making it to 100 healthy. And that's the differentiator there.
My question would be about just about methylation in general. Like, what is it? And when you're looking at the DNA, are you looking for certain segments that give you clues as to, like you kind of mentioned, certain foods or not? I'm just curious to the process of how, maybe in layman's term, you could explain how might you understand what information that the genetics are giving you? Are these based off of maybe like studies where groups of people that have these specific segments are linked into being better on a certain diet or a certain blood type diet or anything like that?
Absolutely. So there's a lot of nutrients that require methylation. Methylation is essentially just the breakdown of the processing in your body of these particular nutrients, right? To make it easy. Now, methylation, some of these nutrients, your body might not be able to process it correctly unless you actually get or take the methylated version of that particular one, because your body can't process it adequately. For instance, the number one thing that we see would be like methylated, I have it right next to me, like a methylated B vitamin, right? So if you have a problem genetically to be able to methylate these particular vitamins, your body's not going to be able to absorb them. No matter how many you take, no matter how much you inject, no matter how much you do as an IV, your body's just not going to process it adequately. And these are essential for all things: metabolism, energy, the way you break down fats, the way you break down carbs, the way your body processes out oxidative stress, all of these things, the way your body processes out physical stress, emotional stress. These are all components which are required, these particular nutrients, for your body to function optimally. And in this particular case, if your body genetically cannot break them down and utilize them appropriately, then you're not functioning optimally.
For my own benefit and edification, is there a specific marker that you've noticed in all these tests that you've done that seems to be more off than on with the majority of people? Is there something in just human society where the norm for a specific genetic marker is more off than on? Or is everybody completely individual in their own sense and way?
It's actually quite amazing, because I do a lot of these DNA tests and I do a lot of the interpretations myself and our doctors. And it's amazing how everybody's so different.
Okay.
The one thing that I can tell you is usually the processing out of stresses, whether it be oxidative, physical, metabolic, that seems to be more of a trend. So something that we're intaking, whether it be our food supply, whether it be, subpar supplements, whatever it is that's causing it, that's one thing that I've seen that a lot of people are having issues with. So that's usually leads us into the next test, which would potentially be like a stool test. Now there, we actually test not just the cells in your mouth or in your blood. We're actually testing the feces, right? To see what it is that your body's processing. What is it leaving on the table, right? So if you're intaking, your diet, you're intaking good foods, and yet somehow, some way, for whatever reason, no matter how much vitamin D you take, you're always low or deficient, it might be actually just going in through one hole and out through the other, and your body's not utilizing it properly. So that's where looking at the methylation testing and then basically connecting those dots to say, okay, there's a problem in the gut. Now that's what we got to start to address.
Is it normally, this question makes sense in my head. I don't know if it's going to sound like it does. Is it normally something that they're eating too much of that's causing the stress? Or is it the lack of something that they're not getting that's causing the body to stress? Is there a difference?
That's a good question. I think that everybody, so I have some patients that when we do these particular tests, they have an overgrowth of bacteria.
Really? So I would have
actually
thought
doing
that was the
too
answer.
good, right? So they're like overfeeding these particular strands of bacteria. So I have an overgrowth of these particular good bacteria in the gut, which are meant to be there just at a certain level, right? And then obviously you have the opposite completely, which is people don't eat fermented foods, they don't take their probiotics, they're just not eating what they're supposed to, and they have deficiencies. So it's not like everybody's the same. Some people have overgrowth, some people have deficiencies. Some people have had years upon years of traditional medicine where they get the slightest little runny nose and automatically they're on antibiotics. So they've just completely just destroyed their flora of the gut. So there's a lot of things that go into it. It all depends, it all depends on the particular patient.
I want to tap into, were you about to say something?
Yeah, while we're on the topic of supplements, you mentioned methylated B vitamins and you just mentioned probiotics. Do you have maybe a few supplements that you feel like are really big movers for people's health, either that you see deficiencies in really often or even like probiotics and maybe collagen and things like that, things that you add that you feel like make big immediate differences, or even on the flip side, if there's other things that you're against supplement wise that you feel like maybe shouldn't be taken?
Yeah. So I think that there's a handful of supplements that are essential and everybody should be on. Number one is a good vitamin D supplement, right? Number two would be a good omega supplement, omega 3 and 6. I'm big on, taking like good fatty acids. So even like if you're going to do like 1 or 2 tablespoons of like raw extra virgin olive oil, something like that. I think good multivitamin, right? And I think with that, most people are okay.
Would you suggest a methylated multivitamin?
Yes.
Okay.
Yeah. Now, with that, most people are okay. If you want to take it a step further, then I'm big on, doing things like glutathione, NAD.
Can you touch on those drips too? I want to just kind of coast in my episode for me. So I really want you to get hardcore into the glutathione. Me and Taylor talk about it all the time. There is a spot up here that does it. I would highly suggest getting it done a little bit more professional, down in your office, or I know you're now going in multiple states. But that, that's one story. It's going to sound like I'm fucking exaggerating, but again, I'm in his office one day and he's like, try this glutathione NAD. And I just this is like my 3rd or 4th time back. I put back on 40 pounds. I started my TRT again. I was active. I usually tend to have higher liver enzymes. So I go for this glutathione NAD plus, which I'd like you to explain further what that is. But I'm sitting next to a woman who's like the poster child for their company. And I think she came in from playing tennis that day, and cancer survivor. And she goes, how old do I? I mean, woman was beautiful. How old do you think I am? I really thought she was like 52. So I said, I think 48 to be nice. Bro, she was 75 years old.
Whoa.
Yes. And they're in a big money area. So, it's not a cheap drip, but it's well worth it. Obviously, I buy them in packs. So I'll buy like 5 at a time. And then every time I'm in Florida, I'll just stop in his office and use one. But she swore she goes every Wednesday for how many years, and it's the reason why she looks the way. And it's literally the drip of like the fountain of youth. And I think it's one of that and the methyl blue drip, I think, are 2 of the most underappreciated treatments in the world. I've spent tens of thousands of dollars on them. It is well worth it. Can you go in depth a little bit of exactly what those are? Because I think they are a game changer in anyone's aspect. From Ian's mother, I'd give it to my 6-year-old. So Can you go in depth of what those are?
Absolutely. So NAD is actually NAD plus. So there's a positive charge to it, right? So NAD is it's a byproduct of niacin, which is vitamin B3, right? So what happens is NAD, the plus, when we flush it into the body, whether it's via IV, injection, or now they have nasal sprays also, that plus, it's basically donates a proton, so a positive charge. Remember, our bodies are energy. It's positive and negative charges. All the cells work off that. Our brain sends impulses down the nerves with positive and negative charges. Our heart beats because of positive and negative charges. So this particular component of NAD, what it does is it donates that positive charge to the mitochondria of every cell in the body. The mitochondria is essentially the powerhouse, right? Or the generator for every cell within our body. The highest accumulation of mitochondria in the body is in our brain, right? So now you're donating a positive charge or more energy to these cells, creating a lot more activity. So it essentially will supercharge the mitochondria to supercharge each cell to perform their task better. So eliminating or detoxifying the liver, eliminating or detoxifying the lungs, stimulating more mental clarity and cognitive function, improving short and long-term memory. I mean, these are all benefits from NAD, right? I agree with Mike. I think everybody should do it.
How long does that last, these benefits?
I'm sorry?
How long do these benefits last? So if somebody gets an NAD plus,
January
drip,
1st.
Yeah, January 1st. So let's say I came down, I went and I got an NAD plus injection, drip, whatever it is. How long do those benefits typically last for?
So if you do an IV, you're probably looking at a few weeks to a few months.
I was gonna say 3 months.
Usually
yeah.
I'll wanna do the IVs, but also keep them supplemented with
the nose spray.
either home injections or the nasal spray at home, right? So think about it, just like vitamin B3. You can't take vitamin B3 once and you're like, oh, I'm good for the rest of the year. Vitamin B3 you wanna take probably every day, right? You don't have to do the NAD necessarily daily, but I would say a drip, I would say at least once every 3 months, a drip, and then supplement with something, whether it's actual NAD or whether it's NMN, which I'll go into in a second, or if it's NMN, to actually on a regular basis to keep those NAD levels high. Your body automatically makes it, right? But what you're doing is you're stimulating more of it, right? NAD is the actual compound we're looking for. NMN stimulates more production of NAD in the body. So you can actually do both, right? And you can do an NAD drip every few months and then supplement with NMN, or you can do the drip once every few months and then actually take NAD regularly. It all depends on the person. Truthfully, I do the NAD nasal spray, I do it daily. And to me, I feel a significant difference cognitively.
Brain fog gone instantly.
It's unbelievable.
Instantly.
Yeah.
What's your take on the NAD pills that's out there? Because there's a lot. I feel you. Don't worry. Like I'm with you on that. But there's a lot of companies out there that market these NAD plus pills. Now I know that has to cycle through your liver, and then the bioavailability of everything. You can't really, absorb the proper compounds and nutrients from that, comparatively speaking to doing an injection, doing a spray. So, what is the benefit, I guess, in layman's terms, of somebody doing a spray, taking a pill, doing a drip?
Okay, drip, you get 100% absorption right into your body.
Okay.
Right, so whatever we put in there goes in there. NAD nasal spray, we have in our sinus cavity a lot of blood vessels, right? And a lot of soft tissue that when you spray, the absorption is actually quite good. Not 100% like an IV drip, but I would say these are not exact numbers, but you're probably looking anywhere from 70 to 90%, right? Capsules has to go through a lot before it gets absorbed into your body, right? So step one, it starts to get broken down in your mouth. And then once it gets into the acid of your stomach, you lose a bunch of it there. Then it gets processed out by your kidneys and liver. By the time it actually gets into your bloodstream,
10%.
It's a lot lower.
That's why I was asking.
That said, it's better than nothing, right? It's better than nothing, but as far as bioavailability or absorption, significant difference, right? So I would say you're better off doing a nasal spray or like little mini injections at the house over doing capsules.
And why would you couple it with the glutathione? What does the glutathione do for you?
So the glutathione is an extremely strong antioxidant. So it's phenomenal for eliminating oxidative stress, which is actually what's known for aging our cells. So the first thing that I get from patients that start on glutathione, and glutathione is also done IV, injection, nasal spray, or capsules, right? Same delivery systems as NAD. First thing that I see or I hear is that their skin quality is improved, right? Like you can just see that it just looks healthier, right? Because the cells are functioning better and you're eliminating a lot of toxicity from your body. So that would be the reason why you would want to do glutathione. And then methylene blue, I absolutely love. You can do it as an IV or you can do it as capsules. The IV, it's very important because sometimes some clinics will do the IVs along with the NAD. You want to make sure that you're not doing them in the same bag. And the reason is because NAD and all other vitamins will usually go in a saline bag. That's what we're all used to, a saline bag. Methylene blue will sediment in a saline bag. So it'll turn into powder as opposed to being liquid. So what you do is you go with a very tiny dextrose bag, right? So it's a glucose bag or a sugar bag. And then that gets injected into that bag and that goes into your body. So the way that I was explaining NAD that has a positive charge, methylene blue actually has a negative charge, right? So now here, what it does is it donates electrons. But the biggest thing that methylene blue does is it increases the consumption of oxygen within the body. Specifically, again, with very oxygen deprived tissues such as the brain. So you feel that instantly as well. And that's something that you want to load. So you probably want to do a few of those kind of back to back, spaced out a couple of weeks apart. And then you can just stay on a maintenance. And there, the maintenance with the capsules should be okay. But yeah, it increases the production of different neurotransmitters in the brain. So, mood improves, cognition improves. It's actually amazing to do.
Instantaneously, like within 30 seconds of it coming out of your vein, you feel it. And going back to NAD glutathione drip, I feel, I've done a dozen of them. I feel like your imperfections come out during the drip. So if you have asthma, you feel your lungs getting like actually repaired. If you're a little out of it cognitively, you feel it in the brain. You feel because you have to control the flush, right? The drip, because some people could take it more than others. And of course, I'm a psycho, so I turn it all the way up. And you could actually feel every single cell in your body from your hair to your toenails. And then as it finishes the bag, it detoxes out of your body through your feet in like a hot flash. And then you get up and you are not sleeping. Take a B12 shot on steroids times 100 for like the next 3 days. You could run through a fucking wall. It is amazing. And then you do the methyl blue, and it's like taking that pill in that movie that makes you like the smartest guy in the world. Yeah.
It's so NAD, that is absolutely true. Like I've had patients that will have the drip and they have asthma and they start wheezing. Or I have patients that their problem is in their stomach and they'll have to take the IV pole to the bathroom.
I did too.
Right? So it all depends on what it is that your body's requiring the most energy for. And because we're donating all those protons,
fixes it.
Your body will actually start to activate that area even more.
I don't know why, but this just triggered something for me. You just said something about the stomach. Now, we didn't really specify the NAD and the glutathione. They're peptides, correct?
Yes.
Okay.
So glutathione's an antioxidant, but they fall into the peptide category. So does NAD.
So I snapped my ankle horrifically before my last Muay Thai fight. 2 tendons, 3 ligaments snapped, and I was told I wasn't walking again for 4 months. And in a matter of a month, I was walking and in the ring fighting. What I did was I took BPC and TB500. But one thing that I noticed, and I was wondering if you could elaborate on this, only because you just said something about, about the stomach. I noticed on BPC 157, I was suffering from digestive problems. And then all of a sudden, while my ankle's healing, my stomach was healing as well from the BPC 157. So I was wondering if that is a normal occurrence, and this is for my own benefit here, or if the BPC actually ties into your gut health and all of the bacteria in there. Because then I did my own research, and the internet tells you 1,000 different things. So for me, because I like that stack immensely, and that thing has healed a lot of different physical ailments for me, I was wondering if you kind of touch on if that BPC actually does help with stomach. Mike wants to say something.
Before you answer it though, so those that are watching, because this is about to go on a fucking tangent. So this is literally the topic that we discussed on the pod that we wanted this podcast for. I've been waiting for this moment. Anyone that knows me, I'm very educated in the peptides. Thank you to this man. We talk all the time. I'm the type of person, if I have a question at 2 a.m., I text him and he answers me when he wakes up. I just want to, and tell me if you disagree, but I think there's a whole different skew of people watching this. So we have stem cells. That's whether you're 18 or 80, whether you have an acute or a chronic injury you want to repair. Then we have, you could be anywhere from 18 to 80. You don't have to go to the gym. You're just getting healthier. You're taking the glutathione, the NAD+, and the methyl blue. They're peptides, but in my opinion, they're apples and oranges to what we're about to get into. And then there's preventative health, which I'm a huge advocate for, and it's what we're about to roll into. We're probably going to have to stop this because I could talk about this for hours, and this is the man, the myth, the legend that taught me it. So going into Ian's question, so this is the BPC, the TB500s. I want to talk about IGF-1, MK677. I want to get into 5-methyl-1-MQ, the GHKCU. Let's go that whole route of these are preventative and post-surgery or injury, like expedited healing peptides. You don't have, this is separate in my opinion from the glutathione NAD+.
Yes.
So I want you to dive into, going back to Ian, why did the BPC and TB500, which I think is the best stack in the world.
Also, Dr. Rosado, before you begin, I've asked Mike for knowledge on peptides.
4 months.
6 months at this point. And the amount of times we've hung out, he hasn't given me shit. So like this is a introduction and a lesson and a learning curve for me for something I've been wanting to know about. Okay. And I've taken so many peptides from being a bodybuilder in the past. So I was putting stuff in my body that I didn't even know like what it did. Like the MK677, I heard it just did so many different things. So if going off that, if you could also tap into how like the IGF-1, the MK677, how that would also help with certain athletes as well, if you could do that as well.
Absolutely. Absolutely. So yeah, this is actually one of my favorite things that we do at the clinic. I absolutely love peptides. So I guess to start and to answer your question about the BP157 is let's take a step back and let's talk about what a peptide is, right? So if you take a protein and you break it down into the simplest form, it's amino acids. It's a chain of amino acids, right? So if you have a specific sequence of amino acids in a specific repetition, that turns into a peptide, right? Or that is what's known as a peptide. Our body, all right, our body communicates within itself utilizing peptides. In our body, there's one peptide specific in the gut, which heals the gut lining. Obviously, there's a lot of damage that happens there because it's human tissue that's holding acid, right? So it's constantly got to be regenerating. So BPC157 is that particular peptide that our body creates to heal itself in the gut. Now, what we did is we were able to isolate that from gastric juice, or the stomach, the juice that breaks down food in our stomach, right? And we were able to replicate it, understand the sequence of the amino acids, right? And how many repetitions, so that when you inject BPC157, your body's creating or repairing your gut lining. Does that make sense?
Absolutely.
And the same way that works for the gut, it works in every aspect of the body. So for instance, if you have, let's just say,
a quad tear. Right?
Yeah. Use my ankle, for example.
Ankle, yeah.
Use my ankle, for example.
With particular peptides, you can create specific actions in your body. So for instance, if you are utilizing for your gut health BPC157, right, you're also helping heal tissue throughout the body in general. TB500, right, helps with the repair of muscle. So BPC157 helps reduce inflammation and heal the gut lining. TB500 will actually help you put new tissue in the body or repair tissue within the body. There's one particular peptide which I've been meaning to talk about on the healing side of it. So BPC157 works amazing. If you take BPC157 and add an arginine to it, it's known as pentadeca-arginate. That particular peptide heals tissue even more and faster than BPC157.
Get out of here, really?
And that's something new, right? All they did is take the BPC157, add the arginine. They had to change the name because it was a different structure, and that heals unbelievably. There's cosmetic peptides, like the GHKCU, will actually help with production of more or better nails and better hair, right? Even better collagen within the skin. So our body communicates and creates actions by using peptides, right? So if my body is low on growth hormone, right? Because as we age, growth hormone goes down. But growth hormones are anti-aging or age management hormone. So if I want to keep that level of that hormone up without actually taking growth hormone, you can take different peptides which will help stimulate what's called growth hormone releasing hormone, or GHRH, from your pituitary gland in the brain. And then that GHRH stimulates your body to produce more growth hormone.
So what would that be, like a GHRP6 or something like that?
Yeah.
Okay.
Yeah. So GHRP6, you've got sermorelin, you have different peptides that will help stimulate your body to produce that particular hormone.
Why does the sermorelin make you ravenous?
I have heard that from a lot of people.
Yeah.
And it just increases appetite. That's just a byproduct of it. There's no particular, some people it happens, some people it doesn't. For the people that does happen to, then obviously we start looking at different peptides that we could potentially go for. There were 2 peptides before. The FDA did kind of change some things around in January.
They suck.
But which is another conversation. Basically they took CJC.
1295. That was the
and
best
Ipamorelin
ever.
off the market.
CJC6
With the Impamorelin stack.
And the Ipamorelin. So, it's off the market. I know that you can still get it online from different pharmacies that are not in the States. My thing is, are you getting CJC and Ipamorelin? Maybe, right? But the thing is, if they're not, a lot of times, like I'll order them, I'll just order them just to order them to see what they look like. A lot of times they're not tested, or they say not meant for human consumption. Doesn't mean that that's not what you're getting. It just simply means that they can't say it for humans, right? So for me, if there's certain peptides that are the alternatives to those that I know these people are being just put under the microscope, especially now more than ever, to make sure that these are the actual peptides, that they do what they're supposed to do, then I'd go that route.
Yeah.
But like there's things like, peptides like nootropics, which help your brain function better, like pinealon, stimulates the pineal gland, so like, better concentration, better focus. There's so many things you can do with peptides. And basically it is what it is. It's a natural stimulation of your body producing it.
I've heard.
Unless you've taken insulin before, or you've done bodybuilding before, obviously you probably are not at all used to like self-medicating through injection. So I'm curious, when you use peptides with your clients, is that all done in office, or do you kind of onboard them into how to administer these things to themselves? Because I know that's going to be a very big obstacle for anybody that's listening. That's like, oh, I would love to try some of these things for my skin, or for my, even I know like melanotan makes you tan. And I think there's just such a big host of benefits through these peptides that a lot of people will go to step 1 and realize that you're having to inject yourself with these things. So I'm just curious as far as how you navigate that with them.
Which ones, can you break down which ones come in? I know the Trots, there's ones that come in pills, there's ones that come in nose sprays, maybe break down some of those.
Yeah, absolutely. So, and there's a lot of them that actually come in various delivery systems, right? So let's just say TB500 as an example. TB500 works phenomenal at stimulating collagen production to heal tissue. So if there's any injuries, or you're trying to prevent injuries, that's a peptide you can be on long term. It works phenomenal. Now that comes in nasal spray, that comes in capsule, that comes in injectable. The injectable is the best absorbed, then nasal spray, then oral, right? When it comes to injections, depending on the peptide, it depends on how often you have to do it. So something like a TB500 or a pentadecaarginate, which is the new BPC, which we'll go over in a second, is you inject once a week, twice a week, right? It's a little subcutaneous injection. We walk you through it. It's either the abdomen, you can do the delt, you can do your glute. As long as you're not getting into muscle and you're just doing it into the subcutaneous tissue, you're fine. Most people, even the people that are scared of injecting themselves, have no problem. After they do the first injection, they laugh at themselves.
So can you also just, as somebody that self-medicated with these injections for a while, there's a difference between what certain people are probably thinking as an injection compared to what you're putting into your stomach per se or into your glute. And I just want you to specify that the type of injection would be, it's an insulin type of injection, correct? So it is a microscopic prick of a needle that you're actually using just to get into that subcutaneous layer of fat, correct?
Correct. It's
Okay.
less than half an inch.
Yeah, there you do 31 gauge, 3/8 inch. I think I do.
Yeah.
It's this big.
Tiny. You don't even feel it. You don't bleed, nothing. Right. It's literally just getting into your body. The moment you get it in once or twice, you're fine, right? That's injectable. And that's the best way to get it in, right? Not all of them come injectable, right? So like, for instance, Mike had touched upon GHKCU. So that's, it's 3 amino acids and copper. That's an injection that helps with the production of collagen and also has been shown to start to regrow and activate hair follicles, right? So same thing with zinc and thymulin. It's another peptide which helps stimulate production of hair, right? So these particular ones, they will come in oral or serum or foam that you apply to the area, and then that gets absorbed into the skin, and you're just trying to stimulate the follicles of the hair or the scalp to reactivate, eliminate DHT, and reactivate the hair follicles to regrow more hair. So the delivery system depends very heavily on the type of peptide, and also it depends on what you're trying to accomplish.
So what's the difference between something like that and then what's on the market for that company Hims, for example, which is Minoxidil. Thank you, Minoxidil.
Yeah.
So what's the difference between a serum or a foam like that, comparatively speaking, to what you're talking about as a serum that is actually peptide derived? Why would one work better than the other?
Sure. So doing something like Minoxidil, right, is actually a medication. So it's a chemical that you're adding into your body, which is going to stimulate an action. It's not naturally occurring. GHKCU, or zinc thymulin, is a naturally occurring compound that in the body creates an action. Peptides are already in your body. All we're doing is isolating these peptides to a much more concentrated dose and utilizing it to create an action, right? So Minoxidil is not in your body. That's an external chemical compound that you're putting into your body to help regrow hair. With that said, I do have some patients that it's not just as simple as here's some GHKCU.
Right.
They need a little extra boost, and we might do both. So a topical application and a capsule of Minoxidil.
That's perfectly said, and I appreciate you specifying that, because I think
Absolutely.
For a lot of guys, I think that's one of their major concerns. And I know a lot of men in particular that are on Minoxidil right now, or finasteride, for example.
Yeah, finasteride sucks. I just came off this shit. I'm fucking done with it.
And
terrible.
I think this would be a good avenue for them to wind up considering and exploring, because nobody wants to lose their hair at the end of the day.
Is it okay if I post? You sent me a picture of the guy with the alopecia with the PRP shots, which I think I'm actually going to do next time I see you. Can you resend me those? Can I post them on here for people to see?
Absolutely.
You got to see the before and after pictures. So this is peptide treatment with PRP injections for hair growth. I think it was like a 6-week pre and post, and then like a 3-month, night and day. It was better than my surgery in Turkey.
Really?
So I'm going down them. Actually, I'm going to Florida tomorrow. I'll probably stop by and do the PRP shots.
I've actually, the hair growth was absolutely
Unreal.
absolutely unbelievable.
So it's okay with you.
What we do is we take PRP, and then we'll also combine that with the peptide, and then we do micro injections into the scalp where there's hair loss, and that stimulates elimination of DHT and the production of new hair follicles
instantaneously, dude. Jay, we'll get a thing to throw.
Yeah,
That's
yeah.
wild.
I'll get you the pictures.
All right, cool.
So let's say somebody is listening to this podcast that has never done any type of injection, any type of peptide. This is a new foreign thing to them. They want to just start on a general health baseline. What could you recommend to somebody who's listening to you right now, where you're making sense to them, and they actually want to go down this path a little bit and say, let me get started? Let's say he or she average type of athleticism, eats well, what could you recommend to them to get them started? Minimal injuries, just the aches and pains, typical stuff. What can they take? And is there any difference between what a male and a female can take? And will there be any adverse effects from one to the other?
It's a great question. So the answer to that last part is yes. There's certain things that males can take that females should not, and vice versa. So the same way that there's peptides that stimulate healing or stimulate hair growth or stimulate collagen production, there's also peptides that stimulate hormone production. So for instance, there's one peptide called gonadorelin. That one, what it'll do is it'll produce more testosterone in the male body. So there's a part in the brain, right? And essentially that part of the brain creates luteinizing hormone, or LH, right? Gonadorelin stimulates more production of LH, more production of luteinizing hormone. Luteinizing hormone in the male body goes down to the testicles to stimulate the cells of the testicles to produce more testosterone and more sperm. Okay? So that particular one would be something that would be male only, right? You don't want a female to jump on that, and their testosterone will not go up on gonadorelin because they don't have the cells of the testicles to produce more testosterone. If a woman wanted to increase testosterone, there's ways to do that, but it wouldn't be through this particular peptide.
Can a guy take that instead of doing TRT?
Absolutely. So in the clinic, we have two different programs for TRT. So there's testosterone replacement therapy. When people think testosterone or TRT, they think testosterone replacement therapy. You're injecting an external hormone into the body, right, to supplement for the testosterone levels that your body's not making. The other option is testosterone restoration therapy. So here we're restoring the body's ability to continue to produce more testosterone. I've got guys that are in 200-300 levels of testosterone, which is terrible, right? And with the restoration program, their numbers jump up to 8, 9.
Come on.
Okay, Dr. Rosado, I got to ask you a question,
No
okay?
way,
And
bro.
you were right about to ask a question, right?
No.
Okay, I have to ask a question because there's a lot of people that I'm in constant communication with, guys I used to bodybuild with. I'm like gripping onto this microphone right now because so I know a lot of men my age to Mike's age, people I used to compete with, guys whose testosterone levels are at 80, guys who are at 90, guys that are at 110, that are supplementing TRT 200, 300 milligrams every week for the rest of their life. They can't come off. So I am imploring you and begging you, are you telling me, and I could have heard this wrong, okay?
I'll switch this shit over right now.
Hold on. Okay, hold on. Are you telling me that there is a peptide out there, and I could have heard this wrong, that can remove the TRT from their life, and they could supplement, and I'm going to botch this name, what is it?
Gonadorelin.
Gonadorelin, that they can take gonadorelin and boost their testosterone back up to a healthy level without having to supplement an external source. Am I hearing you correct on
At
that?
900.
No, hold on. Wait, let's not worry about the 900.
What's
Let's say
important?
500.
No,
Let's say, stop.
you
Let's
gotta
say
be
600.
850, 900 is
Okay.
the optimal level.
Yes, but that's for like a 20-something-year-old
No,
man.
that's
35, 40-year-old man. It's not 8 to 900.
Yes, it is. A 40-year-old.
No, it's not.
A 40-year-old.
No, it's
pumping out
not.
his
No, it's
fifth
not.
kid. His
No,
fifth
it's
kid.
okay. Well, okay, Mike. Can you
The answer is yes. Yeah.
Stop
Again,
it.
Everybody's different, right? However, this is the way it goes. If you've been on testosterone, exogenous testosterone, for a while,
13
right?
straight years. I have not missed a
Your
week.
body now is accustomed to having those levels of testosterone without having to do anything,
Right.
right? So the idea there is not cold turkey stop from one day to the other. The idea there is you slowly come off of testosterone replacement therapy while you're increasing the production of your body's own testosterone levels. Everybody's level will be different. You might come off of T, jump on the restoration program, and be at 400, 500 naturally. You might come off of T and be at 1,000 naturally. It all depends on the person. Everybody's different. The beauty of injecting yourself with testosterone is that it makes it very uniform. Everybody's got the same dosing. You got the same amount of testosterone in your body. You know what you're going to get. In this particular case, if you're trying to stimulate your body to produce its own, it's not just gonadotropin. There's a few other things like clomiphene and stuff like that where you would still need to take. But it would be a process to take the patient, and we do it all the time.
How long is the process, for example? Like if you had to give and I know everybody's different. I understand everybody has different levels. Everybody's body responds differently at a different pace to something. But rough estimate, a year, 6 months, year and a half?
6 to 12 months. 6 to 12 months of slowly coming off of testosterone, and you're increasing your own body's production of testosterone, right? And then it also comes with, there's X factors. So for instance, if you're taking testosterone right now, but you're not taking anything else along with it, right? You're just injecting testosterone. Let's say you're not taking Clomid. Clomid, you're actually supposed to be taking Clomid also, because what that does is it keeps your body's natural rhythm of producing its own testosterone.
Like HCG.
Yeah, HCG.
Right?
Yeah, I hear.
Or HCG.
I hear a lot of people are supposed to take.
You have to, the HCG. The best analogy I was given from a doctor years ago is if you lived in Alaska, you cannot just go outside and start your car once every 2 months. That's your shot, your test shot.
Yep.
Going out every 3 days and starting your car is the HCG of your natural test while you're doing that extra shot. But for someone who's been on
13 years, never missed a day, and still pumping out kids. I get it, bro.
I was 25 years old. I had a level of 120. I asked the doctor what that meant, and he went, brother, yeah, that's the equivalent of a woman trying to be a man at 21 years old. That was the level of testosterone I was on. At 25, I started TRT, and I've spit out 5 kids. My body personally functions between 8. I could feel instantly as soon as I drop below 800. When I hit 1,000, 1,100, it's a little too high. So I'm like that 950. My HCG, I take my anastrozole, and then I take I'm on the BPC TB500 to prevent injuries. I personally like the MK677. I just tried that 5-amino-1-MQ you sent me. I think that stuff's great for fat burning. But I'm definitely hitting you up for this transition, because whole nother conversation, but I did a lot of research with MIT, did a study on using the insulin syringe on the natural test, not the stuff you buy off the street, because the oil is salvageable in your sub-Q shot. So even just a quarter cc in my stomach, maybe every 10 days instead of shooting 100, 150 mgs twice a week to stay at that same level.
There's a lot of research right now, and I've actually been doing a lot with patients, is we'll do a micro dosing of testosterone subcutaneously.
Yep, it helps.
And then again, not all testosterones are created equal. You need to order it from the right place.
Right.
So it's got to be a blend of testosterones. Yep. And then the ideal thing is getting it in an oil, such as, because if you go and you buy your testosterone at a local pharmacy, 9 times out of 10, maybe even more, it's in cottonseed oil.
Yep.
Well, cottonseed oil is not meant necessarily for human consumption. Like, you don't eat cottonseed oil, right? So the ideal scenario is to get it into a base oil, such as organic sesame seed oil, which is edible, organic grapeseed oil, which is edible and anti-inflammatory. My favorite is in MCT oils. So everybody knows the importance of medium chain triglyceride oils, right? So now they're actually using MCT oils as a base oil, and then using a combo of different testosterones where your body's gonna process it at different timing. And if you do that as micro doses, instead of doing like a 1 cc or 1.5 cc a week of testosterone, you're doing a quarter twice a week.
Yeah. What is it, like a decanoate or like?
Yeah, I was about to say enanthate, cypionate, propionate, it's things like that.
Propionate, cypionate, and enanthate. You get that combo because some of them are fast acting, some of them never peak. They kind of just keep your levels up. So instead of having the peaks and valleys of being on testosterone therapy, that you feel like King Kong for 3 days, and then you feel lousy afterwards for the next 4, what you're doing is you're getting a nice steady level of testosterone throughout the week. So it's a lot better for your system too.
And we can get that through you as well?
Yes.
And then what about someone calls you tomorrow, they want to start. How do they get some of these drips from you? Like they have the money to do it, but they don't have the money to fly to Florida. So how are they doing it up in New York? And B,
question.
how easy is it it's today's Tuesday. They're going to call you tomorrow and I want this. How fast can it get there? What kind of timelines is it? Like how easy is it to move forward with this life change?
Also, right before you answer that, how accessible are you, or is it a
24/7?
So that's my question. So a lot of something like somebody like me, I would want to be in contact with the source. For example, I would want to be speaking to you. So are you speaking to the patients?
Yeah.
Did Mike get just special treatment? Are you in contact with somebody like me? If I were to call you who has these questions, are you putting us in touch with one of your nurses there? How does that work as well?
Yeah. So first, I think the first thing that separates us is that we actually don't necessarily have nurses. All we hire is MDs, doctors.
Okay.
So when you're talking to anybody in the office, medically, it's all doctors.
Awesome.
Right? So I try to make it so that I am the primary point of contact for anybody that comes into the office. On the back end, you know, the treatment protocols and stuff like that, it might be another doctor, but you will have access to myself or my team. My number one thing is customer service. If I wouldn't go to the place as a patient, we train our team regularly, and it's solely on how to treat people like human, how you would want to be treated, right? So our big thing is making sure that everybody feels comfortable, feels great while they're doing their therapy, but also feels great dealing with us as an office. So if you look at our reviews, we got 5 out of 5 stars, and almost all of them, it's all about the service, right? Most people have access to the same pharmacies. It's about how we put these programs together, the knowledge of putting these programs together, but also how we treat you as an individual, and then address your individual goals, right? Most places it's cookie cutter, plug and play. Exactly. Everybody gets the same thing. In our office, our big thing is making sure everybody's looked at as an individual, look at their individual goals, and then address them accordingly.
How do they get the blood work to you?
They schedule an appointment through the office, and they can request the doctors. Like I said, usually I'm the intro call, and any questions that a patient has, I'm always accessible.
So now they give you a call. They say, "Hey, I'm very interested." From my experience, it's usually some type of blood work to get some type of base, or they want to go through this methylation test that you send to them. Now they want to start ordering stuff. It's literally as easy as a phone call. Then they get their prescriptions sent to them to their local pharmacy. I get it directly to my house from you guys. It is that easy.
I'm big on convenience. I like things to be convenient for me, so I expect that my patients are the same. So it's all about convenience for the patient. So the idea is we jump on a quick intro call, see what the goals are, see what's going on, see what we need to do, see what we need to order. We'll order labs. We'll take a look at all the baselines. Then we sit down and we do an in-depth dive, explaining everything in detail so that who I'm talking to understands what's going on, right? It's very important for me to understand, or for the patients to understand what we're talking about, right? Then from there, once we understand what's going on, we put together a protocol. Then the protocol gets shipped directly from the pharmacy to the patient's house. And we're licensed in about going on 30 states now. So, we can just ship straight from the pharmacy straight to the patient's house. Then with that, you get videos on how to do things. You get a kind of a breakdown on the dosing, all of that. And you also get, you can schedule a call, and we'll walk you through everything. Like to the point where I'll grab a needle and be like, hey, this is how you do it. So you're gonna pull it up to here. So we have everything down so that most people have no questions. But if there still are questions, we're always here.
Now, a lot of this will not be covered under insurance, correct? Because that's
traditional blood work will be covered, right? So, or even like for the stem cells, if we need to do an MRI, we can order the MRI through insurance. Advanced testing like genetics, methylation,
of course,
and micronutrient testing, that's not covered. There's not even a code for that. There's none of those labs are covered by insurances. As far as therapy goes, peptides are also not something that's covered by insurance. But we do have programs that we try to make it as accessible as possible. My thing is not oh, I want my prices to be as high as possible. My thing is, how do we make it so that we can help as many people as possible? Because when I help more people, then they tell other people, and then they come in. So it's as long as we're doing a good job and we're actually caring for the patient, we've noticed our predominant source of patients coming in is referrals from happy patients and other doctors that also happen to be patients, right? So we've got patients from Canada, from the Virgin Islands, all over the States, and they refer patients over to us regularly. I'm constantly on the phone or on video calls with patients that don't live in Florida. And we also have patients that fly in regularly for these treatments, whether it be stem cells or PRP or PRFM.
And you still have the credit care was the card I was talking about. That's 0%. You can't get denied on it. It's just you're capped at however. But I mean, I have shit credit at the time, and I think I got like $5,000 instantly. It's 0% credit card, 12-month terms. It's very doable on the payment. And again, I use the analogy of I've been scammed in the pharmacy world. There's something called the compound pharmacy, which is different than a regular pharmacy. And, when I switched over to the first doctor, a real doctor for the first time, all the levels that I've been told, my HCG and my testosterone, it was all fake. And it was at zero. So they're like, you weren't even taking HCG. So whatever they think you were getting, it was zero. It was fake. It's not even like it was weak.
Right.
And you look into these places and, I'm not going to bash them on the podcast, but you find out there's like 19-year-olds just packing shit in the back. So you're going to get the quality over the quantity.
You got a lot of stuff coming from China and stuff.
Yeah, the labs they use are phenomenal. And just because something is cheaper or more convenient does not mean it's better. And that's what you want to be careful before you go down your own little rabbit hole. We have a great source here that's direct. And we're going to put up all his info. We'll tag him in Instagram reels and maybe at the end of the show put up some information I get from him on who they can contact and move forward. I think also, I personally got a lot of reach out the last 2 episodes with the physical and the dieting. I got a really, and what I said again, for me, a lot of people, if 5 or 6 people instantaneously, we release at noon, by 2:30, if I get 5 or 6 instant text messages, that's like a reel getting 100,000 views, and I got a lot of, oh my God, how are you guys so big with such a minimal gym time? How did you get in such good shape with such an easy diet? This is the next step. We focus our podcast on men's mental health. And now we're on the stages of how to better yourself. You've been through your hard times. And I think this is a great avenue moving forward. Now you're back in the gym. You're working on your diet. Maybe you're getting your first little ache and pains. I cannot stress how important the mental and the gut health, like Doc said, is on your testosterone level. You might be going through the ringer and you go get your testosterone level checked and you're at a 250, which is like a 21-year-old female. So I think it's time. Your next step is you're eating healthy. You're getting out of that forest that Kate talks about. You're getting in the gym, even if it's only 2 or 3 days a week. Now, how do you prevent getting hurt? You can give Dr. Rosado a call, get some blood work done for free if you have insurance, methy get some peptides, get a little TRT schedule. If you went through X drug use, the glutathione NAD+, the methyl blue will help get your mentality right and kind of driven on where you want to move forward in life. We're giving you guys, the stepping stones on how to get out of where you're at. So, a couple more episodes in, there is no more man, what do I do? Watch the fucking show and now implement it in your living and make the changes. And if you have any questions or if you like what we're doing, keep reaching out. We'll have all of Dr. Rosado's information up there. You guys can, the ball's in your court now, and it's only going to get better every episode. So I want to thank you again for coming on.
Thanks, Doc.
You guys have anything to say to close out or?
No, Doc, I really appreciate this. This was a long time coming for me since I've been begging for this type of knowledge. So I appreciate finally getting it from the actual source. So very much appreciated. I'm going to be reaching out to you for a couple things, and I'm also going to put my mother in contact with you. So when she's watching this, Mom, this is the guy that you're going to be speaking to moving forward.
Yeah, and I've sent dozens of guys to him. We had the one guy that didn't turn his neck for 15 years, right? Former Marine, hasn't turned his neck 90 degrees in 15 years. Guy runs 3 miles every morning now. Multiple back vertebrae. That people wanted all these crazy fucking fusions. My buddy just went down there to see him with a couple guys, 50, 60 years old, best he's felt in decades. So it's always better. Don't wait till you're fully injured to have to try to heal yourself when you could prevent, very minutely getting hurt. So always stay ahead of the curve. And you also learn a lot about your body. You learn what it likes, what it doesn't like. And when you're spending that little extra time with yourself, it kind of vibes with it. And you become more one with yourself. And I feel like this is a great stepping stone. And there's no one else that's going to take their time out in this field like Doc does. So I want to thank you again, man. And I'll see you soon. And definitely looking forward.
You guys putting out some amazing stuff. So I'm just grateful to be a part of it.
Awesome. Are you coming? Are you up here by Christmas time again or no?
I'm going to see if I can make a trip up there.
I was saying, try to get up here. We'll do another episode in person.
Sounds good.
Awesome, brother. Appreciate it.
Thank you, Doc, so much. I really appreciate it.
You got it, guys. Have a good one.
Take care, Doc.
Look, will you be absolutely genuine with me? No deception, please. I want you to do something that expresses you without the slightest deception.